Living Well with Sickle Cell, starring Helen. Upcoming is Dakota as the parents. Then it's the doctors Lauren and Bree. Then yours truly, Eric as the son.
I can't believe we're having a baby.
I know, isn't it exciting?
It's so exciting.
Yes.
I hope we have a boy.
No, we're gonna have a little girl.
We should see.
Mr. and Mrs. Murphy, you guys ready to come back?
Yes. Don't touch me.
What are you guys in today?
Well, I'm very close to my due date, and I found out recently, well, not necessarily found out, but I've always known that I have the carrier for sickle cell disease because a few family members of mine have had it. And I don't have it, but I'm just wondering if it's gonna skip me and go to my baby.
Have you been tested? Do you carry the gene?
I don't think that I carry the gene, but I don't have access to my records, so we just want to be tested just to double check.
Okay, well, we can definitely do that today.
And being that I'm more familiar with the disease and the symptoms and what's it like to be around someone that has it, can you explain to my husband what it's really like?
Okay, well, it is autosomal recessive, so you guys both have to have the gene for your baby to be affected. It's a abnormality in your blood cells, and it basically just causes a lot of complications. But you will have a genetic counselor if your child is born with that disease. Don't worry, it is very common in the United States. About 100,000 Americans are living with sickle cell, and it's definitely treatable. So let's get you guys tested.
Okay.
I'm gonna go ahead and test you today for sickle cell, and all it is drawing your blood.
Okay.
Okay, I'll be right back. Tell your husband to come in.
Are you sure we have? I mean, I'm saying though, if it skipped me, it skipped them. It'll skip my baby, I'm sure. We don't really have to
Just in
test
case,
him.
we're just gonna make sure that your husband doesn't carry the gene because you'd rather know if your baby's gonna have sickle cell than not know at all.
I think I know, you know.
Well, when
We
you're
got here
pregnant,
some way,
there
you know?
isn't any symptoms, so just in case, we're just gonna bring him in. Okay, well, I'm just gonna draw your blood. It might sting a little, but we're just gonna test you like we did your wife for this gene.
Okay, just be easy.
Are you hoping for a boy or a girl?
I want a boy, but my wife wants a girl.
Well, hopefully whatever it is, it's healthy.
Yeah, I hope so too. Speaking of that, did she say anything like off to you?
I don't think so.
Because the other night it was really weird. We were just like sitting there talking, and then she just disappears. And it was like 3 hours before she came back.
Well, you know, pregnant women, sometimes they go get donuts or things like that. They just go through like hormonal phases.
Yeah, hopefully.
Hopefully that's all you got, right? You are positive and you do carry this gene. Dakota, you're negative, so you have nothing to worry about. But just out of precaution, we're going ahead and test this baby just to make sure nothing is wrong with it. It's going to live healthy, okay? Are you okay?
No, I'm having like really bad cramps on my side. I think I just have to use the bathroom or something. Woo! Woo! Woo!
What are we doing?
Breathe. Hurry up!
Thank you guys for coming in. I'm just gonna prick your son. It's just gonna hurt a bit, so he might cry. We're just gonna test him, like I told you, to make sure he doesn't have this disorder that you carry, okay?
Okay.
Okay, well we got it. It's just gonna take a couple of days, just like y'all's did, but we'll let you know as soon as possible.
Okay.
So the blood results are back, and unfortunately your child does have sickle cell. But we are a little confused because the dad was negative and didn't carry this gene at all, and he has to carry this gene to be possible.
Helen, what's going on? I thought She just said it was impossible.
Well,
Spit it out!
remember that fight we had back in August?
Mm-hmm.
Well, I just got really angry at you.
Mm-hmm.
I went to go see an old friend of mine, and I knew his eyes were a little yellow, but I didn't even think nothing of it. Like, and now we're here, and well, I still love you, you know, and I'm so sorry.
Look at this little monster. How can I not know? Look at him.
Did you do that?
Look at him.
Oh! You're so beautiful.
You're not my daddy.
Hi, my name is Dr. Brunson. Dr. Lovett had referred you all to me for the recent diagnosis of your baby Eric, who has sickle cell disease. And I'm just going to go over some of the symptoms and treatment that goes along with having the sickle cell, okay? Some of the symptoms to look out for would be abdominal pain. It would be mild to severe joint pain and muscle pain. It would be fatigue. It would also be trouble with blood flow through their veins. Also, nausea and vomiting would be a part of the symptoms for sickle cell to look out for, okay? Some of the treatments would be antibiotics. It also would be pain relievers, bone marrow transplants, and blood transfusions. However, from when he is 2 months of age to 5 years, they will be treated with antibiotics. Typically, penicillin is what we give. And typically also blood transfusions is what we recommend after the age of 5.
So will we notice any of those symptoms before he turns 1, perhaps?
It's going to be kind of hard since he will still be a baby. Just make sure you're extra precautious. When he does cry, he may be having some of these symptoms like abdominal pain and fatigue going on. All right, how is baby Eric doing?
He's with his biological father.
Oh, really?
Yep. Yep. And I need a lot of help, and I'm going through a lot of emotional issues.
I'm sorry to hear that.
Did you do marriage counseling by any chance?
I do not do 2 for 1s.
Okay. Okay. So excited. This is fifth birthday.
Here he comes.
Surprise!
Happy birthday! Happy 5th birthday,
Oh my
Eric.
goodness, that's all mine.
Yes, all the cups and all the napkins. You like your cake?
Yeah, but my stomach kind of hurts.
Are you sure? You don't
I'm
want any
feeling
cake or
kinda faint.
anything?
No, I like cake right now.
Well, come on, buddy.
Oh, you sure?
Yeah,
Okay.
come on. We'll do this a
go.
little bit later.
Bye, cake. Thank you, guys.
You're welcome.
Bye.
Hope you feel better. Has he been feeling this way for a while?
He has. He's just always having these weird stomach cramps, and he's just not wanting to do anything. He doesn't have any energy anymore. I don't know what else to do for him.
Well, since he's 5 now, he is able to start getting the blood transfusions that he needs.
Okay.
So that's great.
Okay, awesome. I don't know. I've been researching lately. I know this is not necessarily new to me, but it's new to have a child that has sickle cell disease. But I've researched that at Georgia Regents University that they're doing testing on cannabis oil.
They sure are.
And I think it's reducing some of the very severe pains that they're having.
Correct. The first trial was done last week on a seizure patient, and they're also doing them for sickle cell disease patients. So hopefully that will be, a big step in the near future for curing symptoms.
Can't believe we're having a baby.
I know, really exciting.
It is exciting.
Yes.
I hope we have a boy.
No, we're gonna have a girl.
We shall
Mr.
see.
and Mrs. Murphy, you guys ready to come back?
Come on, Theo.
I'm coming.
Oh, can we redo that?
Hey guys.
Hi.
I'm glad you guys could make it in today. I have some news for you. So Helen, you were right. You are positive and you do carry this gene. And Dakota, you have nothing to worry about. So the blood results are back, and unfortunately your baby does have sickle cell. But we're a little confused because the dad was completely negative and is not a carrier of this gene at all.
Helen, I thought this was impossible. What's going on?
I have something to say.
Well, spit it out.
Okay. Not too long after me and you had intercourse, I went to an old friend that used to be really close with him, and well, he said he would just be there for me no matter what the circumstances were. And he told me he would take me out from time to time and give me money.